Onc Live Insights is a video editorial program produced by Onc Live.
In patients who are getting the Optune or the tumor treating fields, there was a lot of worry and some anxiety among the patients early on and practitioners that this would badly interfere with quality of life. Because of course, to apply these electrodes to the head, the patient's head has to be shaved every 2 or 3 days. Electrodes have to be reapplied. They have to carry around a battery pack to keep the device going when they're out and about during the day, and plug in at night. And usually we wanted to see the patients wearing the device at least 3/4 of the time, at least 18 hours a day. So there was a thought there was going to be a lot of interference with patients' lifestyle. And in fact, what I found with my own patients is that they adapt pretty well to this. Minimal complaints that I've seen in my patients about the weight of the device, which, as I said, the current device weighs about 6 pounds, although there's a newer device that's been approved in Europe right now that cuts the weight almost in half, newer battery design these days. There's some concern, and we certainly see in the clinical trials that more men than women are willing to use this device, as a lot of men frankly don't have to shave their hair very much by the time they're wearing this. A lot of our male patients are bald by the time they get glioblastoma. There is the worry about the cosmesis with this, but you can wear hats, scarves, wigs over this. And as long as you're not in the summertime where you need to ventilate a little bit of heat and get very sweaty underneath whatever hat or wig you might be wearing, most of our patients did very well. And I've even bumped into a few of my patients with the device on at local ice cream shops, at local stores. We had one of our patients who continued to teach a computer science class and go hiking and even kayaking with the device, although we advised him to unplug during the time he was on water. And most patients found it was not a big interference to their lifestyle. The most interesting thing we found was we had so many patients on device at one point is that a group of our brain tumor support groups started meeting sort of separately as the Novacure or Optune wearers group. The group would trade ideas on how to wear the device, different little hats, wigs, and whatnot to hide the device, how to get about your day-to-day life, and perhaps most importantly, the patients got reports every month on how much they wore the device, what their on versus off time was. And as we said, we shoot for at least 75% on time with the device, but we found in our little support group that our people would compete against each other. And the patients who were wearing it 91 and 2% would sort of cajole or tease the patients who were only wearing it 80 or 82%. And that competition probably does make a big impact, because there's some data that I have seen that suggests the longer you wear the device, the more commonly you wear it, the better the device does, and that makes intuitive sense. The device is electrical, it's either on or off, and if the device is off when a tumor cell divides, you've missed the chance to kill that cell until the next division. So we found the device to be rather empowering in our group. It was one of the few times that a patient did something every day to fight their cancer, as opposed to having something done to them. They don't get to a chemo chair and get plugged in and have poison put in their veins. They're not sitting there and getting radiated. They're shaving their head, they're putting the device on, and they're using it every day. And it was a very interesting psychology we had in the group.
Patients using the Optune device should be counseled that the data from the studies done on Optune has demonstrated that when the patients utilize the device for 18 or more hours per day, it is most beneficial. So patients are often concerned about using the Optune device 24 hours a day and want to have a break from the device. The ability to disconnect from the device or even remove the arrays for several hours per day is often very helpful practically in the patient in terms of continuing their normal activities. Although upon initial consideration, it often seems to the patient that the device may be unreasonably difficult to utilize, in reality, when the patients are using the device, they find that the backpack is a minimal encumbrance, and that because they can disconnect from the backpack during a significant portion of their day, that it is feasible to utilize the device in the treatment of their tumor. Because the mechanism of action of the Optune device is through the application of alternating electrical fields, patients often wonder if they'll feel heat on their head or shaking on their head or some sort of electrical sensation, and patients do not generally complain of that feeling. In the studies that have been done on the device, what was found to be the most common side effect of using the Optune device has been skin irritation. When this occurs, it is managed in concert with the patient's physician through use of topical agents and rarely systemic agents and modifications in the array application to allow healing of any skin ulcers or irritations that may occur as a result of using the device.